It only takes a glance at a hospital bill or at the myriad choices you may have for healthcare coverage to get a sense of the bewildering complexity of healthcare financing in the United States. That complexity doesn't just exact a cognitive cost, it also comes with administrative costs that are largely hidden from view, but that we all pay. Because they're not directly related to patient care, we rarely think about administrative costs. They're high. They're also the topic of this week's Healthcare Triage. A widely cited study published in the New England Journal of Medicine used data from 1999 to estimate that about 30% of American healthcare expenditures were the result of administration, about twice what it is in Canada. If the figures hold today, they mean that out of the average of about $19,000 that U.S. workers and their employers pay for family coverage each year, $5,700 goes towards administrative costs. Such costs aren't all bad. Some are tied up in things we may want, such as creating a quality improvement program. Others are for things we may dislike, for example, figuring out which of our claims to accept or reject or sending us bills. Others are just necessary, like processing payments, hiring and managing doctors and other employees, or maintaining information systems. That New England Journal of Medicine study is still the only one on administrative costs that encompasses the entire health system. Many other more recent studies examine important portions of it, however. The story remains the same. Like the overall cost of the U.S. healthcare system, its administrative costs alone are number one in the world. Using data from 2010 and 2011, one study, published in Health Affairs, compared hospital administrative costs in the United States with those in 7 other places: Canada, England, Scotland, Wales, France, Germany, and the Netherlands. At just over 25% of total spending on hospital care, or 1.4% of total United States economic output, American hospital administrative costs exceed those of all the other places. The Netherlands was second in hospital administrative costs, almost 20% of hospital spending, and 0.8% of that country's GDP. At the low end were Canada and Scotland, which both spend about 12% of hospital expenditures on administration, or about 0.5% of GDP. Hospitals are not the only source of high administrative spending in the United States. Physician practices also devote a large proportion of revenue to administration. By one estimate, for every 10 physicians providing care, almost 7 additional people are engaged in billing-related activities. It is no surprise, then, that the majority of American doctors say that generating bills and collecting payments is a major problem. Canadian practices spend only 27% of what U.S. ones do on dealing with payers like Medicare or private insurers. Another study in Health Affairs surveyed physicians and physician practice administrators about billing tasks. It found that doctors spend about 3 hours per week dealing with billing-related matters. For each doctor, a further 19 hours per week are spent by medical support workers, and 36 hours per week of administrators' time is consumed in this way. Added together, this time costs an additional $68,000 per year per physician in 2006. Because these are administrative costs, that's above and beyond the cost associated with direct provision of medical care. In JAMA, scholars from Harvard and Duke examined the billing-related costs in an academic medical center. Their study essentially followed bills through the system to see how much time different types of medical workers spent in generating and processing them. At the low end, such activities accounted for only 3% of revenue for surgical procedures, perhaps because surgery is itself so expensive. At the high end, 25% of emergency department visit revenue went towards billing costs. Primary care visits were in the middle, with billing functions accounting for 15% of revenue, or about $100,000 per year per primary care provider. Costs related to billing appear to be growing. A literature review by Elsa Pearson, a policy analyst with the Boston University School of Public Health, found that in 2009, they accounted for about 14% of total health expenditures. By 2012, the figure was closer to 17%. One obvious source of complexity of the American healthcare system is its multiplicity of payers. A typical hospital has to contend not just with several public health programs like Medicare and Medicaid, but also with many private insurers, each with its own set of procedures and forms, whether electronic or paper, for billing and collecting payment. By one estimate, 80% of the billing-related costs in the United States are because of contending with this added complexity. An additional source of cost for healthcare providers is chasing patients for their portion of the bills, the part not covered by insurance. With deductibles and co-payments on the rise, more patients are facing potentially unaffordable cost sharing, possibly leading to rising costs for providers or the collection agencies they work with in order to get them to do so. Using data from Athena Health, the Harvard health economist Michael Chernow computed the proportion of doctors' bills that were paid by patients. For relatively small bills, those under $75, over 90% were paid within a year. For larger ones, over $200, that rate fell to 67%. A distinguishing feature of the American health system is that it offers a lot of choice, including among health plans. Because insurers and public programs have not coordinated on a set of standards for pricing, billing, and collection, whatever the benefits of choice, one of the consequences is high administrative burden. And that's another reason for high American healthcare prices. Special thanks to Olsen, who wrote the Upshot column from which this episode was adapted. Hey, do you like the show? Always helps if you like or subscribe right down there. And another good way to support the show is a subscription service called Patreon.com, which allows you, the viewer, to directly support Healthcare Triage through a donation, as little as $1 a month, or more if you like. Anything helps. We'd especially like to thank our research associates, Joe Sevitz, Jonathan Dunn, and Crafty Geek, and of course our Surgeon Admiral Sam. If you'd like to help subscribe to the show through Patreon.com, go to patreon.com/healthcaretriage. Also remember, Healthcare Triage merch is available at hctmerch.com, and of course my book, The Bad Food Bible, still on sale in stores.